Okay, so as part of Module 4, Body Systems, so Urinary System. Okay. So the urinary system is consists of two kidneys, two ureters, okay, uh, the urinary bladder and the urethra. Okay, so the ureters connects the kidneys to the urinary bladder, and the urethra is the one that connects the urinary bladder to the outside world. So dun yung dumadaan yung ating urine, urethra. So wag lang malilito between ureter and urethra. Okay? So pag sinabing ureter, ito ay connection or anatomical um, structure that connects the kidney and the urinary bladder. And then urethra naman, it uh, it connects the bladder towards um, the expulsion or the excretion of urine towards the outside world. Okay? So the main function of the urinary system is the elimination of urine, and this urine contains metabolic waste from the body. Okay? So our kidneys filters the blood. So as you can see in the image, okay, yung ating mga blood vessels ay dumadaan sa kidney. Okay? So it filters our blood, removes the waste from the blood, which turns into urine and excreted outside the body or excreted from the body. Okay? Okay, so the kidneys are located behind the peritoneum of the lumbar region. So it is dorsally located. Okay? On top of each kidneys, okay, makikita natin yung adrenal gland. Okay, so the adrenal gland, also called as suprarenal gland. Kaya siya tinawag na suprarenal gland because it rests above the kidneys, suprarenal. Okay? So in the kidneys, you will also see the structures or the structure of the kidneys. So the kidney is a bean-shaped organ, para siyang bean. Okay? Red bean, parang red bean na ang kanyang shape. Okay? And it is may mga parts siya such as the renal medulla, the renal cortex, okay? The pyramids of the medulla, the renal capsule. Renal capsule encloses the cortex. And then we have the calyx, the calyxes or the calyces, and the renal pelvis. Okay? And the primary unit or the working unit of the kidneys is called nephron. Okay, so that is the functional unit of the kidney, nephron. Okay. So we have two root words for kidneys. We have nephro or nephro and reno. Okay. Then we have the urinary bladder. Okay, so the urinary bladder serves as temporary storage of the urine until the expulsion from the bladder outside. Okay, so yung tissues, yung inner tissues ng bladder ay tinatawag na rugae. Okay? Para siyang mga folds sa urinary bladder. Okay, rugae. And then, doon sa base naman niya, meron siyang triangle shape area. Okay? Na, ito yung nagko-contract. So it is called the trigone. And of course, meron siyang sphincter. The internal sphincter. Okay? So sphincter yung ko-control ng ating urination. I mean, if we ito yung kapag constricted yung sphincter, so sarado siya, no urine will pass through. And then kapag naman siya ay dilated or nakarelax ang sphincter, so urine passes through the urethra. Okay? Then, ano pa ba? Okay, so it is also seen in the image, the prostate gland. Okay, so prostate gland is only found on males. Wala pong prostate gland ang females. Okay, so the prostate gland is included in the discussion of the urinary system. But also, it is also included in the discussion about the reproductive system, the male reproductive system. Okay. So, urination, it is the process of eliminating urine from the urinary bladder towards the outside of the body. This is also called micturition. Okay, micturition is the medical terminology for urination. In the clinical setting, we may hear frequently the word voiding. So voiding is also used for urination in the clinical setting. So urination, voiding, micturition is the process of expulsion or excretion of urine from the bladder to the outside of the body. Okay, so this table is for roots for the kidney. So I mentioned earlier, the two root word for kidney is ren and neper. Okay, so they both pertains to kidneys. Okay, on the other hand, we have the glomerulo, which means glomerulus. So juxtaglomerular means near the glomerulus. Okay. So the glomerulus is part of the kidney. Okay. Next is paielo or paielo, which means renal pelvis. So paieloplasty is the surgical or the plastic repair of the renal pelvis. Or then we have the cali or calic. Okay? Meaning calyx. Plural is calices. So the example given is calictasis. Sorry, calicectasis, dilatation of the renal calyx. So if, when calyces, the renal calyces, um, constrict, kapag ito ay nag-constrict, lumit yung daluyan ng urine or nagkaroon siya ng obstruction ng bara. Okay? So nangyayari, syempre, the kidneys will be inflamed, mamamaga, and then mapupuno siya ng fluid. Okay? Then it will progress to what we call um, hydronephritis. Presence of fluid that causes inflammation in the kidney. Okay? So routes for the urinary tract, except the kidney, we have the uro, which means urine or urinary tract. Urosepsis means generalized infection that originates in the urinary tract. Then we have the urino, which means urination, discharge of urine. Uretero, okay, so that is ureter. So the example is ureterostenosis. So stenosis meaning narrowing. Okay, so narrowing of the ureter. Then for the urinary bladder, we have two roots. We have the cysto and vesico or basic. So the example for cysto is cystotomy. That is surgical incision of the bladder or urinary bladder, cystotomy. So the inflammation of the urinary bladder is cystitis. Okay. Then the other example is intravesical, which means within the urinary bladder. Intra, within. Then vesico, urinary bladder. And of course, uretro, which means urethra. So uretroscopy, endoscopic examination of the urethra. So the endoscopy will be inserted into the urethra. Okay. So in this slide, it tells us about the Staghorn calculus or calculi. So it is a renal stone or kidney stone that fills the renal pelvis and the calyces to give a staghorn appearance. So para siyang, it appears like the horn of a stag. Ano ba stag? Male deer. Okay? So ito yung uh, mukha siyang sungay ng stag, kaya siya ay staghorn. Okay? So itong buong to ay calculus, meaning stone. So ang laki niyan, stone yan. At bumabara yan dyan. It may cause nephritis. Okay. So what is the medical terminology for renal stone? Ano po medical term ng renal stones? Or stone in the kidney? Okay, class, any volunteer? Or anyone who knows the answer?
Nephrolyte po ba?
Nephrolite is
Yes, po.
nephrolite is the stone found in the kidneys. Nephrolithiasis, okay, it is a condition wherein there is a kidney stones or a kidney stone present. Okay, nephrolithiasis. Siyempre, kapag plural, nephrolithiasis. Okay? Okay, so next is the, ito ay condition din, ureterosil. Okay? So it is a cyst-like dilation of the ureter near its opening into the bladder. So ito yun, ureterosil. Okay? So siya ay may dilation. Okay, paglaki ng daluyan ng urine, ng ureter, okay, near its opening. Okay. So, the possible problem is pwede siyang magkaroon ng bara, pwede siyang magkaroon ng stone sa ureter that causes dilation of the ureter itself near the opening, or it can also be a result from a congenital narrowing of the ureter opening. Okay? It can be hereditary, or it can be by uh, a kidney or a ureter stone, okay, that causes dilation. Okay. When we say dilation, lumalaki yung tube, yung tubing. Ito yung ureter, yung mismong um, tubing ng ureter, lumalaki siya. Okay, nagdadilate. So, para siyang cyst-like dilation. Okay? Kasi hindi siya nakakalabas ng, or yung lumalabas dyan ay konti lang. Kasi nga either narrow, makipot yung opening, or meron siyang blockage. Okay? So that is ureterosil. Okay? So for clinical terms, so acidosis, excessive acidity of body fluids, okay, bacteriuria, presence of bacteria in the urine, okay, cast, a solid mold of a renal tubule found in the urine. So siya ay mold. Ano ba yung mold? Parang amag. Okay? Then cystitis, inflammation of the urinary bladder. Then we have dysuria, painful or difficulty in urination. Then we have the glomerulonephritis, inflammation of the kidney, primarily involving the glomeruli. Okay? Then we have hematuria, presence of urine of blood in the urine, hematuria. Okay, then hydronephrosis. Okay, so collection of urine in the renal pelvis caused by obstruction. Kaya nagkakaroon ng inflammation of the urine of the kidney. Okay, also called nephrohidrosis or nephridosis. And then we have hyperkalemia, excess amount of potassium or increase amount of potassium in the blood. Oliguria, elimination of small amount of urine. So oligo means scanty or few. Then proteinuria, presence of urine in the urine. And pyelonephritis, inflammation of the renal pelvis. And in kidney, renal pelvis. Then pyuria, presence of pus in the urine. Then renal colic, radiating pain from the region of the kidney associated with the passage of a stone. Uremia, presence of blood toxic levels of nitrogen containing substance, particularly urea, okay, as an amount or as a result of renal insufficiency. So yung urea, ito yung naamoy natin na mabaho sa ihi. Halimbawa, pag umihi tayo, hindi natin na buhusan agad ng water yung ating toilet. Okay? After ilang time, magkakaroon ng reaction yung urine sa air at magproproduce ng urea. At ito yung naamoy natin na uh, pungent odor. Then we have the urethritis. Urethritis, so inflammation of the urethra. And urinary stasis, stoppage or stagnation of the urine flow. Okay. So cystoscope, dialysis. So itong dialysis is done to patients with uh, kidney problems na uh, ang tanging pag-asa na lang ay renal transplant or kidney transplant. Okay, hemodialysis, okay, removal of unwanted substance from blood by passage through a semi-permeable membrane. Okay, then we have IVP, intravenous pyelography. Okay, this is a special radiographic examination that uses contrast media, iodinated contrast media, to check for presence of stones, kidney stones, ureter stones, gallbladder stones, or urethra stones. Okay? It is also used to check the patency. Kung wala bang bara ang ureter, ang urinary at pelvis or calyces. The same time, pati ang ating ureter. Okay, next we have the lithotripsy, crushing of stones. Okay. The specific gravity of the urine is 1.015 to 1.025. So itong SG, specific gravity, usually ito ay kinukuha or nire-request para sa mga pregnant women. Then we have the laboratory test urinalysis or urine analysis. Okay? So it is the physical and chemical testing and microscopic appearance. Okay? So, kung nakapag-urinalysis na kayo, usually makikita nyo sa result, anong color, meron bang presence ng RBC, ng white blood cell, ng pus, ng protein, ng sugar, etc. Okay? Then surgery, cystectomy, surgical removal of all or part of urinary bladder. Then ileal conduit, diversion of urine by connection of the ureter to an isolated segment of the ileum. Okay, one end of the segment is sealed and the other drains to the opening in the abdominal wall. Okay, so very uncommon surgery. Then lithotomy, incision of an organ to remove the calculus. And of course, the renal transplantation or surgical implantation of a donor kidney to a patient. Okay, for abbreviation, so ano yung mga importanteng dapat tandaan dito? We have the erythropoietin or EPO. We have the CRF, chronic renal failure. We have the BUN or blood urea nitrogen. It is also part of the laboratory testing of the blood. Then DFR, the glomerular filtration rate. Okay, na tinitingnan natin before we um, accept the patient for um, for the what we call uh, contrast examination studies. Okay. So KUB radiography means kidney ureter bladder. KUA, UA means urinalysis, UTI, urinary tract infection. Okay? So, until dyan lang yung ating discussion. And for the rest, you may read your book. Okay? For the next lesson, okay, our